We're seeing a lot of information out there about vitamin D and its role with this COVID-19 pandemic. They've done a number of studies and found that a large majority of people that are dying from this, specifically dark-skinned people, have profoundly low vitamin D. They haven't figured out exactly what the role is, but they know it has something to do with immune function and something to do with cytokine storm. So vitamin D supplementation is paramount. Normally we get vitamin D by the sun penetrating our skin and activating it in a certain way so that it's useful for you. The other part about vitamin D is that it's fat soluble. It tends to stay in the fat. So if you have a high fat content, you tend to store your vitamin D and not mobilize it for your body to use. So you might need supplementation if that's the case. The other factor with vitamin D is the darker your skin is, the less sun can penetrate your skin. Now that's an advantage if you live in the tropics or in Africa, because too much sun damage, we know, causes DNA damage. It can cause cancer and aging of the skin. If you live in that area, the melanin in that skin, the tint, acts as a protective barrier to keep that sun from over penetrating your skin, but you get enough to fixate your vitamin D. But then you live in the Midwest, or you live in a cold climate in America, you don't get a lot of sun, you have this protective coating over your skin, so you're at a double disadvantage of having low vitamin D. So it's super important to take a supplement in order to get adequate vitamin D. If you're not able to have enough sun to activate it, then taking it by mouth is important. 800 to 1,000 units is a typical beginning dosage. I take 15,000 units a day. Taking 50 to 60,000 units puts you at risk of getting toxic, so don't go to that level. But it's a simple thing to take. You can start at 1,000. If you're really worried about it, you could do 5,000. But I'd also recommend getting your vitamin D level checked. A lot of insurances don't pay for it, but you can get it done at any local lab for anywhere from $50 to $60. And if you're worried about it, it's a small price to pay. So once you know where your vitamin D level is, then you can be a little more aggressive with your supplementation. And my vitamin D, the normal is between 20 and 100. Mine is at 60, and that's with taking 15,000 units for a year straight. But I don't get a lot of sun exposure besides on my arms. And so it is what it is. So don't blow off vitamin D as a supplementation. It's really important. It's super easy. The tablet is about the size of a Tic Tac, and it's very easy to tolerate. So make sure your vitamin D is supplemented, and that will ensure that your immune system is functioning better than it was without. Thank you.